Intense pulse light, or what is commonly known as IPL, is a very effective treatment in the management of photoaging as we all get older. And what we mean by photoaging are the brown spots that we get on our face, as well as the increasing number of broken blood vessels. So this is a treatment which came into vogue around the year 2000, and its purpose was to a great extent to replace lasers in the management of broken blood vessels as well as for brown spots in the face. The advantages of the intense pulse light are that typically it does not bruise. You can treat the entire face region. Lasers do tend to bruise, and frequently you cannot treat the entire face region the same way. So around 2000, intense pulse light came on the market and emits a wide, broad width of wavelengths that we can use for the management of various facial problems. Essentially, it is computer driven, so it has a computer screen in which we can dial in exactly what condition we're treating. Because it is computerized, it will tell us exactly what settings to use, what type of filter to use on the laser machine. We then turn on the machine and we treat the patients. And typically most patients that receive intense pulse light are here for about an hour. It takes about half an hour of using a numbing cream to numb the areas, because there is a slight sting to the treatment. The treatment itself usually takes 20 to 30 minutes as we go over the entire face in order to do the treatments. When we do the treatments after we've removed the freezing gel, we typically put glasses or eye shields to protect her eyes. We ourselves are wearing goggles, and we then go over the entire face with this treatment. After they leave, they are usually able to go right back to work, so there's no downtime associated with this treatment. Occasionally there might be a little bit of puffiness. Occasionally the brown pigment that you're treating may become more obvious as a result of the treatment, but most patients have no problems after this treatment is done and return to work. Typically what I tell patients is that if it is a question of browns and pigment problems, usually 2 or 3 treatments will remove a lot of that pigment. If it is a question of flushing and blushing and redness, it requires more treatments. In fact, I tell individuals that usually it requires 4 to 6 treatments to get between 40 to 50% improvement, and even after that, treatments are required maybe once or twice a year as maintenance. I'm now going to show you, after I turn the machine on, because it does make a bit of noise, I'm going to show you how we are going to bring about a treatment with respect to Debbie. So Debbie is now ready to receive a treatment. She's had her topical freezing gel on for the last half hour, so the area is already slightly numb. You realize that she's wearing her shields, eye shields, to protect her eyes because the light is very, very bright. We're now going to put on a little bit of ultrasound gel, and this is to make the treatments easier and simpler. It allows the head of the intense pulse light machine to easily slide over the areas that we're going to treat on the face. We have now pre-programmed our settings for the intense pulse light machine. So her main problem is that of rosacea and excess flushing. We are going to use a certain filter, certain energy. We push the ready machine. And this is the crystal. We have different sizes of crystal, but this is the crystal that we're going to use for treatment of her skin. So we're going to start here, and typically I say 1, 2, 3, and again, 1, 2, 3, and again, 1, 2, 3, and one more time, 1, 2, 3. So you can see in this way we are very quickly able to go through go over the entire skin surface and to be able to treat some of the uneven pigmentation, some of the redness, and some of the flushing that she has. And typically what we're trying to do is to tone down the flushing and the redness that many people experience that suffer from rosacea. She will return in a month's time for a second treatment. Typically we do these treatments mainly in the fall, winter, and spring. We do not like individuals to have too much in the way of a suntan or to use any suntan lotions or creams or suntanning products when we do these treatments. With respect to what the patient feels, they will feel a numbness and a tingling. The light is very bright, so with the brightness of the light, that is one of the reasons why they call it intense pulse light, and frequently that is probably the main thing